I would say a structured exercise plan will definitely help to ease the pain.
So, are there any exercises as well to reduce lower back pain during pregnancy?
A very good question asked. Cardiovascular exercise, going for a walk, cat and camel stretches, body weight exercises.
Pregnancy is a beautiful journey, but it also comes with its challenges. One of the most common struggle during pregnancy is lower back pain. To guide and provide a solution on this, we have Ms. Preeti Kulkarni, a physiotherapist at Cloudnine Hospital, Pimple Saudagar, Pune. Welcome, Preeti, in today's episode.
Hi Radhika. So I'm glad that today we are going to talk about a very common topic which has always been overlooked by, that is lower back pain in pregnancy.
Okay, let's get started.
Yes.
Is lower back pain normal during pregnancy?
Yes, lower back pain is very common in pregnancy and it is also known as pelvic girdle pain. It is a very common musculoskeletal pain and it can happen in any stage of pregnancy. It is always been ignored. I can say that many a times it has been considered that it is normal. So women do consider and ignore the symptoms like pain, persistent pain, difficulty in walking, or especially the pain between iliac crest and gluteal fold, which can hamper their experience of ANC journey, and it might continue in postnatal period as well.
Okay, so what causes lower back pain during pregnancy?
As there are structural and physiological changes happening in the body, so there are a number of factors. One of the factor could be increase in weight gain. Another could be biomechanical changes which are happening in the body. So if we see a posture of a pregnant woman, there is an increase in lumbar spine curve and anterior pelvic tilting. Another could be prolonged sitting working hours or past history of lower back pain. Another could be as there is an increase in joint laxity, and when it comes, there are lots and lots of hormonal changes which happens. So these are few causes of lower back pain in pregnancy.
Okay, so how can one relieve lower back pain during pregnancy?
A very good question asked. So I want to answer it in a way. Let's go by trimester. So when it comes to first trimester, there is an increase in estrogen. So I always suggest that please go ahead with some stretching exercises like back stretches, calf stretches that will help to ease the pain. And when it comes to second trimester, let's add some weight. If you are adding weights, that will give an increase in muscle strength support, that will help to build strength. And one additional bonus point would be when you are going for a labor, then that time you will have a good muscle endurance. So starting with some pelvic bridges exercises or wall assisted squats exercises, these are few exercises that you can start. When it comes to third trimester, as there is an increase in relaxing, so let's focus not to add any additional weights now. Continue with whatever weights you were adding to it, but add some relaxing exercises like happy child pose, cat and camel exercises will help to relax. With that, managing your stress with some deep breathing exercises, changing your position in every 2 to 3 hours, adopting some active desk setup like you are standing for a while and then working, and taking frequent breaks will help.
So, are there any exercises as well to reduce lower back pain during pregnancy?
Definitely. Combination of exercise will help you to ease the lower back pain. Let's talk about some cardiovascular exercises. So exercises like going for a walk, going for a short trail walk will help in improving the blood supply. When it comes to flexibility exercise, let's talk about some cat and camel stretches that will help to stretch the tighten muscle. Strength training will improve the muscle tensile strength by including some body weight exercises, doing some wall assisted squats, calf raises will definitely to build the muscle load.
So, can sleeping positions help with lower back pain?
I want to add to it. No, but definitely it will give comfort to the mother.
Okay.
So focus on having a good firm mattress and adding pillow. It will definitely provide the comfort.
Okay, so can lower back pain during pregnancy indicate a more serious problem?
Not that severe. That is how a physiotherapist will help you to take care of your pain in pregnancy. So a detailed assessment would be done. They would be checking your range of movement, strength of a particular muscle, and then accordingly they will be designing a plan for you.
Okay.
That will help you to take care of your ANC journey thrill your postnatal care journey.
Okay, so let's end up with one last question. When should an expectant mom see a doctor for lower back pain during pregnancy?
Okay, so I want to answer in that way: early the approach, early the intervention, early the management is. So, in every phase of pregnancy, you must visit your physiotherapist. So, according to your trimester need, she would be guiding you. So, ignorance should not be done. If whether you are experiencing persistent pain or radiating pain to your lower legs or tingling numbness, that time you should visit the doctor. But as I suggest, do not ignore. Precaution is always better than cure.
Yeah. All right, it was great having you here. Thank you so much for sharing your valuable insights.
Thank you for having me.
And to our listeners, if you found this episode helpful and informative, do share it ahead and subscribe to our YouTube channel.